The town of Vienna is located on the banks of the Nanticoke River, in the southernmost part of Dorchester County on Maryland's eastern shore. Vienna was an important source of goods and supplies to the Continental Army during both the Revolutionary War as well as the War of 1812. In 1894, the Baltimore, Atlantic, and Chesapeake Railroad was formed, and a rail line running from Claiborne in Talbot County to Ocean City was constructed, crossing the Nanticoke River at Vienna. Time and technology advanced, and soon the railroad, and the trade brought with it, faded into the background, weakening the town's economy and leaving Vienna much less financially stable. When the Nanticoke River Bridge, accessed by Route 50, was completed in 1991, access to cross the river was removed, taking with it the remaining Ocean City-bound tourist-generated revenue. Today, the town of Vienna is greatly lacking in availability of health and social services, leaving the residents at risk. There are no physician offices, health clinics, dental offices, social services offices, or shelters. The Vienna Fire Company provides the town with fire and emergency medical first responders. However, it's a volunteer agency, and according to one town residents, there is a lack of volunteer availability, and the response times in emergencies is greatly increased, as those calls for help need to be diverted to Cambridge departments, the closest of which is 15.4 miles from the Vienna town center. Upon examination of the town of Vienna's community resources, it was found that there is a lack of accessibility to health and social services. By improving access to these services, the overall health of the community will improve, and the apparent disparities will be greatly decreased. A short-term goal, to be implemented within 6 months to 1 year, is to improve immediate access to health care and improve personal safety. The following interventions will aid in attaining this goal. Delmarva Community Transit provides the town of Vienna with regular stops and subsequently access to health care and social services throughout the Eastern Shore. Providing the community with signage and information pertaining to these DCT routes and encouraging residents to utilize these services or promote use of services not provided within the town limits. Providing local, convenient access to healthy foods, including fresh fruits and vegetables, will improve residents' short-term health and have earnest impacts on the community's overall long-term health. This can be accomplished by working with local farms to provide a weekly farmers market and contracting with the Maryland Food Bank to provide fresh alternatives to the community on a regular basis. Staffing the firehouse with emergency medical technicians and/or paramedics will greatly improve the emergency outcomes and personal safety of the residents of the town of Vienna. Contracting with the Dorchester County Health Department to provide health promotion brochures at the community center will provide residents with materials that will promote their health. Increased police presence will dramatically improve the personal safety of the residents. This may be accomplished by hiring a town police officer and contracting with the Dorchester County Sheriff's Department and the Maryland State Police to provide routine and regular police presence. Ultimately, the most effective way to remove the health disparities in the town of Vienna faces is to provide the residents with convenient and local health services. The time frame for implementation of this long-term goal is 1 to 3 years and can be accomplished by implementing the following. Survey the residents of the town of Vienna to assess the health care needs and determine the best day and time to provide access to these services. Also, a location to provide these services within the town limits will be needed to be established. Partner with the University of Maryland Shore Health System to provide mobile health van similar to the Caravan program offered by Johns Hopkins. This program will provide access to primary medical care, immunizations, acute care, sexually transmitted infection testing, and referrals to outside care as deemed necessary. Utilize the existing community center to hold regular health screenings and to routinely provide healthcare teaching such as breast and testicular self-examinations, smoking cessation, and drug and alcohol abuse awareness. Develop a program that will provide teaching to elementary-age children on the dangers of smoking, use of illicit drugs and intentional misuse of prescription medication, and the use of alcohol. Provide nutritional counseling to the residents of the town of Vienna. Implementing these interventions should have a positive impact on the health of the residents of the town of Vienna.